Hi guys, I'm Barrett from Optimise Interviews, and I thought it would be useful today to talk to you about how to prepare for the clinical scenario. So this will be drawn heavily on the techniques that we have developed in the last 5 years at Optimise Interviews, and that we found worked really well for the trainees that have gone on to get posts who reported back that this was a key part of their preparations. So it's something we really encourage. The first thing that we'll talk about is why the clinical scenario. And I think the clinical scenario, if you look at the rubric, is worth just under half your total marks that contribute towards your ranking. So in that respect, it's incredibly important. But also, it's a station where it's unfortunately very easy to drop marks if you don't get certain points across. And so I think it's based on last year alone. I think if you're getting a 3 out of 5 in the clinical scenario, you're probably struggling to get a post. If you get a 4 out of 5, I think all bets are on, and it's up to you to do well in the other stations. I think if you get a 5 out of 5, you've given yourself a very, very good shot, a very strong chance of getting the post that you want. So it's really, really important to try and nail the clinical scenario. And I think the first thing we're going to talk about here is the structure and the technique that we use and suggest to Optimise. And then I'm going to have a couple of worked examples to show you exactly how you put this into play so that you can go away and use this for your own preparations. So the first thing I do is write down a list of topics of things that can come up in your IMT clinical scenarios. The whole point of the IMT program is breadth rather than depth, I think. So you're certainly not expected to know topics in anywhere near the same level as the SPI level interviews, but there is unfortunately a huge amount of topics to cover, which I think can make things difficult. And I think it's important to list all the common topics, but also some of the less common topics, the common topics that you come across usually, such as pneumonia, falls, hyponatremia, but less common topics such as management of hypertension or IBD flares that you may not be so commonly seeing in your everyday take, that I think is still really important, especially some of the outpatient managements that you need to be aware of. As we try to base our knowledge update videos now, scenarios on areas that have come up in the past and areas that we think may potentially come up. And I think, whether you use our resources or not, I think it's still very important to have that list and tick them off as you go through and are comfortable with each of them. Then I think, what is the structure? What is the structure that you should take when you're approaching a particular topic? And I think first thing is to say there are core points, and there should be at least 3 core points that you should have for each topic that you must say. And we call these our cannot miss points. And these are things that if you don't say, you will struggle to get more than 3 or 4 out of 5. And then after that, there are your 5-star points. And these aren't necessarily things that you're going to get from the books or the guidelines. I think these are things that a strong, experienced IMT would be aware of, pragmatic points that help make the registrar or your consultant lives much easier. And I think these are points that show that you kind of immerse yourself or have taken an opportunity to speak to lots of IMTs. And we really, really try and highlight this on our vignettes on the website, the 5-star level points that are more pragmatic than necessarily guideline based. So I'm going to go through a couple of examples now. So one is a renal example and one is a cardiology example. So the first one is an AKI. So when you're approaching an AKI, what are the cannot miss points? What are the things you absolutely must say in that station? The first is your AKI screen. It needs to be in the tip of your fingertips in a structured format and not just a list. So one way to break it down would be bloods, imaging, urine dip, and know what you're checking for on each of them. And know, for example, on the urine dip, you're not just checking for nitrites and leukocytes. The second cannot miss point is having a structure for the possible differential diagnosis. And the classic one to use is a pre-renal, renal, and post-renal. But it's not just being able to say that, it's being able to know the diagnosis behind each bucket and be able to talk through why your investigations or the scenario thus far has pointed you towards one or the other. And then finally, I think a really key piece of core knowledge that you'd expect to get across in your scenario is knowing the indications for emergency filtration or dialysis. And so these are well, I know we break them down to refractory acidosis, 2 blood tests, one, so refractory hyperkalemia or systemic uremia causing uremic pericarditis, and refractory fluid overload. So knowing those are the tips of your fingertips, so you can say to the examiner, yeah, I'm going to be a very safe IMT, and I know my core piece of knowledge. And then what are your 5-star level points, the things that really show that you're ready to be an IMT, and one that the consultant or registrar sitting across you on the panel would love to have you as part of their team. And so these are, first one, I think, is speaking to the nursing staff to give them an idea of the parameters that they should call you about. One particular one, I think, is urine output. So they know if the urine output drops beyond this level, you'd like to be called so that you can reassess the patient. And you're particularly thinking about whether you need to tweak the management or involve ITU. And that's a really, really useful thing to show that you're helping spread the burden of managing the patient and spreading the responsibility so everyone has buy-in to the patient. I think that's a really mature thing to have as an IMT and as a registrar, to be fair. I think the second thing is to have a bit more understanding about the background of the patient, especially the cardiac background in cases where there's fluid overload. And so knowing the baseline ejection fraction and when that was done, and also possibly raising the idea of whether you can get a quick V-scan by someone in A&E that can do a quick focused echo, or one of the cardiology team if they're around, to give you an idea of the patient's current ejection fraction. And that gives you an idea of how your therapies, especially with regards to fluids, may work and how quickly you can give those fluids before making things slightly worse. And that shows a maturity with how you're approaching the situation and you're thinking ahead as well, which I think is very important. And then a final thing, which again is a pragmatic thing, and seemingly thankless, but I think really impressive, is if you can say, yep, and also calculate their eGFR and creatinine clearance and adjust all of their medication, including their prophylactic Clexane or anticoagulation, respectively. That is something that often gets caught out. And when there are problems with bleeding or clots, then that's one of the first things that are looked at in terms of serious incidents. So consultants and registrars are always incredibly thankful when these boring things are done well. So mentioning that you do that and you be that IMT that would go through all the medications and correct them for the new creatinine clearance or EGFR, I think is a very, very good step and shows that you're really a 5-star level candidate. So I hope that gives you an idea of a renal scenario and how what you should have in your core points. You should have your AKI screen, you should have your differential diagnosis list, and you should have your indications dialysis, and then your 5-star level points. That's your adjusting all the medications, team can get a quick B-scan, understanding their baseline ejection fraction, and then also speaking to nursing staff to get the whole team involved so that everyone is aware of the patient's parameters and where they need to start getting worried. And that's also really important for your 1-minute handover. So now let's talk about another example, bradycardia. So what are the core pieces of knowledge of bradycardia? So one really important piece of knowledge is to be able to look at ECGs, and we, again, have a lot of these on our website. So going through ECGs and being able to appreciate, understand, and recognize complete heart block. So recognizing complete heart block on an ECG comes up in the past, and I'm sure it will come up again. What's the second thing that you need to be able to do as a core piece of knowledge for bradycardia? I think if a patient's got complete heart block, you need to be aware of the ultimate definitive management of this is a pacemaker. And I think you need to know that this is an emergency. You need to be contacting cardiology to make them aware straight away. I think these are kind of core piece of knowledge if you're dealing with bradycardia. Recognizing complete heart block, and once you have, knowing the definitive treatment is a pacemaker and contacting cardiology urgently. These are things that make you a safe IMT. But what are those things that make you a 5-star level IMT? There are lots of things, but for younger patients with complete heart block, and I think generally less than 60 for this, so if you're less than 60 in complete heart block, it's being aware that there may be other causes of complete heart block, such as amyloid. So the cardiology team may want to try and do things such as an MRI before putting a pacemaker in, if the patient is stable enough with complete heart block. The second is talking about the escape rhythm and the stability, the relative stability of the patient. So has this patient got a broad broad escape rhythm, which indicates it's coming from low down in the ventricle and is therefore electrically less stable, or does it come from higher up with a narrower, faster escape rhythm, which indicates that this is an electrically safer escape rhythm and form of complete heart block? The second or third thing now, I think, which is a very useful 5-star point, is being aware of not just the fact that a pacemaker is now the definitive treatment for complete heart block, but being aware of other therapies that you can hold patients with in the interim. And so that's things such as an isoprenaline infusion or even a temporary pacing wire. And an isoprenaline infusion is something that can be started and titrated up, which is something that the cardiology teams will often do. And I think this is very important for you to be aware of because it's something that can be commenced down in A&E. And that moves on nicely onto the final 5-star point is this patient needs CCU level care. They can't be cared for on a cardiac monitored bed. They need a CCU level care because they need continuous monitoring and will likely need something like an isoprenaline infusion. And if they deteriorate, the cardiology may consider a temporary pacing wire out of hours or straight to a pacemaker if they're in hours, depending on the services involved. I think those kind of things really highlight you as a 5-star level candidate that's not able just to recognize complete heart block and know that they need a pacemaker, but has thought about, well, what are the causes of complete heart block? May they need an MRI beforehand if they're stable enough? And what are the other things that we can do to make them more stable if they have got complete heart block? And where do they need to be cared for? I think those, again, mark you out as a strong IMT that has a fair idea of some of the pragmatics of dealing with these patients. So hopefully that's a useful video to help you prepare for your clinical scenarios. Please don't leave it too late. It's really important to have that list of topics and have, I think, 3 cannot miss points and 3 5-star level points. Try not to write too many down because I think the more you write down, the harder it is to remember an interview. So just have, I've go through a rule of 3 for every scenario I have. So rule 3 cannot miss, 3 5-star level points. And I think that will put you in a very good stead for your interview. So yeah, thanks very much for listening and very best of luck. And as always, contact us if you have any questions at all. Thank you.